have it. Order, order. Debate which is being introduced by Lee Anderson. I call Lee Anderson to move the motion.
Thank you, Mr. Chope. It is indeed a pleasure to serve under your chair today. Now, sepsis is one of the least well-known medical conditions and the number one cause of preventable death in the world. 11 million people die each year in the world from sepsis, and that represents 1 in 5 of all deaths in the world. Now, sepsis can be very difficult to detect and hard to distinguish from other illnesses. Sepsis claims more lives than lung cancer, bowel cancer, breast cancer and prostate cancer put together. It's truly astonishing. Across the UK alone, 48,500 people die a year from sepsis. The Academy of Medical Royal Colleges suggests that figure is much higher, at about 68,000 a year. That's incredible. Now, given that there are approximately 200,000 cases of sepsis each year in the UK, it costs the NHS between £1.5 and £2 billion every single year. And the wider economy, at least 11 billion, some people think it's closer to 15 billion pounds a year. And the direct cost of sepsis to the NHS is 1% of the budget. Now, one of the reasons I've requested this debate today is because I've got many constituents who have been unfortunate enough to suffer from sepsis. And I have a very brave young lady in the hall today, who is Abby. She's sat at the back. And I'm incredibly proud of the strength and determination she's shown to overcome this illness. She's a survivor. But I'm going to tell Abby's story because in November the 28th, 2022, she'd been to a doctor's for some antibiotics for tonsils because she's a long sufferer of tonsillitis. She thought it was tonsillitis again. She's suffered with that all her life. That's understandable. At 6 p.m. on that day, she was blue lighted to King's Mill Hospital in Ashfield to the accident and emergency because she was fighting for her breath and literally dying in front of her husband, Steve, who sat there. When she got to the hospital, she was given numerous injections of adrenaline. Whilst travelling to the hospital, they thought she was having an anaphylactic fit, which was a reaction to the antibiotics that she'd had that morning. When she arrived at the A&E, she was put on 10 litres of oxygen, but it was evident that this was not enough. It wasn't doing the job. But they didn't, unfortunately, administer any antibiotics or put her on IVs at that time. No blood tests were taken, and her husband, Steve, was constantly asking the staff, is there something else we can do for Abby? Only now, looking back a few years later, was it clear that sepsis was never thought of at the time. Abby very quickly deteriorated, so she was transferred to the ICU at Kingsman Hospital, where she was placed into an induced coma. She was fighting for her life, and all her organs began to shut down at a very rapid rate. Only when the ICU did some tests and start to take, when the test started to take place, did staff realise how ill she was and that she'd actually got pneumonia, strep B and sepsis. However, this was just the start of her journey. When the ICU team realised that it was far more complicated than they could deal with at King's Mill, so they contacted Glenfield General Hospital in Leicester, and she was transferred to be placed on an ECMO. That's a machine that takes the place of the heart and the lungs. I suppose it's a life support machine. She was very lucky to have fitted the criteria to go on that machine, and she stayed there on that machine for the next 3 weeks, fighting to stay alive in a coma. And without that machine, she would not be here today. There are only 5 of these machines in the UK, and it costs, I think it costs the NHS £20,000 per day per patient. During the process of being on the ECMO machine, it was visible to Abby's family that she was going to lose both hands and both legs beneath the knee, because sepsis had taken over her body, giving her gangrene. On December the 17th, she was transferred back to Kingsmill Hospital, ICU, because she was no longer had to be on the ECMO machine at Leicester, but she still needed round-the-clock intensive care treatment. On February the 9th, she was transferred to Nottingham City Hospital to the burns and plastic ward, where she would wait for her amputations. Imagine that, having to wait in hospital knowing they're going to take your arms and your legs away after everything she's been through. On May the 4th, she was discharged, having spent 6 months in hospital and coming out as a quadruple amputee. And unfortunately, she told me just before we came in, she sometimes forget that she also lost the sight in her left eye. It's incredibly sad. Incredible brave lady. That's Abby's story. And I want to thank her for sharing that with me. And, yeah, I've got other constituents contacted me about sepsis. There's Karen from Ashfield, her elderly mother contracted sepsis, had a very awful time at the hospital. The diagnosis was slow, wasn't picked up properly, and just a few months later, sadly, her mum collapsed and passed away. Now, Neil from Ashfield, he was much luckier. It was picked up very, very quickly. They got the antibiotics into his body. He made a full recovery. Pam from Ashfield, it was very lucky for her husband that she was a former nurse. She recognised the symptoms and insisted that the hospital put the IV and the antibiotics into his body very, very quickly. Because I think you've got a window of about 12 hours to get these antibiotics in. And the point of this debate is today is getting that awareness out there, not just in the wider community, but actually with the hospitals as well, because it's very unfortunate that this is being missed. And you know, I don't know, in Abby's case, maybe if they'd have picked it up quicker, then we would not be sat here today. But, you know, Shirley from Ashfield, she had a better experience. The hospital picked it up very, very quickly, and she made a full recovery. So there are people making full recoveries from it. And we all know about the sad story of our colleague, Craig McKinley, Lord McKinley now. And I've been having conversations with Craig over the past few weeks about this debate. He can't be here today, but he had a torrid time. His wife was told he was going to die, but he fought back. I think she put pictures of his family on the roof of his room at the hospital, and he's a fighter, is Craig. And it nearly took his life, but it took him several months to get over it. We didn't know where he was. We thought he was just on holiday somewhere at first, but we didn't see him for months. And then, you know, we heard what condition he was in. But he came out to Parliament a few months back, and I've got to be honest, there wasn't a dry eye in the house when he walked in. The bionic man, he walked in, and it's so emotional. But he's living proof that you can fight back from this disease, and you can, you know, have a reasonable quality of life given the right support and a good hospital. As I said before, it's like 48,500 people a year die from sepsis. Other organisations put it much higher. You know, when you think about it, it's 1,000 people a year dying from sepsis in this country. Yet if you stop somebody in the street and ask them what sepsis was, they'd probably struggle to tell you. But the symptoms, very high or low temperatures, uncontrolled shivering, confusion, passing urine less than normal, blotchy or cold arms and legs. Now, I know this because a few years back, my wife had these symptoms, and my wife's she's got cystic fibrosis, and she's post-double lung transplant, so she's got all sorts of medical problems as well. And we thought it was maybe rejection of her lungs or pneumonia or something like that, and managed to get her to the hospital, and it was sepsis. And they told us at the hospital that if you'd have left it any longer, she would have died. Simple as that, she would have died. Because she's got the other complications, she's got no immune system, etc. So last year, I think it was, when she had it again, we knew straight away what it was. You know, the same symptoms, so, you know, we've got her there pretty sharpish. So I also learnt today from Abby as well, on her road to recovery, she's got prosthetic limbs, and I don't know if the minister's aware that she's on a list at Leeds Hospital to have a hand transplant. So she's got her prosthetic limbs. I know she's got her hand for a right arm, but she's on the list for a hand transplant, which I think is absolutely amazing that we're doing that in this country now. And it offers people a lot of hope. And she doesn't stop smiling, does Abby. But I guess what I'm asking for, Mr. Chope and colleagues and Minister, is we have a campaign in this country for strokes. We all know the symptoms now of strokes. You know, we've all seen the stroke campaign on TV about the face. You know, can you talk? About can you lift your arm? Can you keep your arms up? We know all this now. I guess what I'd like to see is a campaign for sepsis. So families and, more importantly, our hospitals are fully aware. And what does it cost to put some antibiotics in somebody just as a precaution? If they get any shaking, they're cold, they're blotchy, they've got fevers, you know, for goodness sake, what does it cost to put, you know, an IV on them and get some antibiotics pumped into them while they can do the other checks?
Will the honourable member...
I will give way, I'll certainly give way.
And I would like to congratulate him on bringing this important debate. And I would just like to put to him, does he agree that sharing stories, not you know, all of us sharing stories of those that we know affected by sepsis, as he has done so sensitively today about his Abbey, yeah. Does he agree that that helps to highlight the importance of early recognition of this dreadful disease and the importance of early diagnosis?
Yes. I thank the honourable member for intervention. Yeah, she's absolutely right, if I'm honest, and this is what this debate is about today. It's about sharing stories. Like I said earlier, you could probably ask 100 people on the street what sepsis was, and the vast majority would struggle to tell you what it was and what the symptoms were. So what we need, and it's quite right, is a campaign awareness, whether that's in schools, whether that's through social media, whether that's through the TV or whatever. I would really like to see a campaign on sepsis so everybody knows the symptoms. So I'm going to wrap up now. I've spoken for 13 minutes, and I know there's lots of colleagues here that want to speak as well, and I am conscious we've only got an hour, so thank you for your time. Thank you, Mr. Cho.
The question is, this House has considered sepsis awareness. Mike Wood.
Thank you, Mr. Chope. And I congratulate the honourable gentleman for securing this debate on such an important issue and one that is very close to my heart personally. And I hope that honourable members will forgive me if I start by just speak about myself a little. In January 2017, after the Christmas break, I came back to Parliament, like many colleagues did, with a bit of a cold. And of course, you carry on working. After all, it's just a cold. The weeks went by and it was getting a bit worse. Course of antibiotics. I suspect, like the honourable gentleman, a 7-day course of antibiotics very rarely clears up an infection for a gentleman of my physique. And so within a short period, the infection was starting to come back, and I had sore throat. But nevertheless, it's only a sore throat. So I went out to Strasbourg for the Parliamentary Assembly Council Europe meeting that week, and whilst there, it deteriorated. I was feeling really, really grotty on the Tuesday morning, so I just stayed in my hotel room. Wednesday, so bad, I sent someone to do me a favour and go to a chemist, and by Thursday, things had got so terrible that I booked an appointment with a GP in Strasbourg, which is a typical man. I mean, this was very much at a last resort, and the GP did the normal checks, blood pressure and the like, and gave me a throat spray. Anyway, I was feeling pretty awful, so flew back that evening, struggled through constituency events on Friday. By Saturday morning, I was getting up, putting my suit on top of my pyjamas, told my wife I had to come down to Westminster to vote. She recognised this wasn't entirely typical behaviour and phoned for an ambulance. Within a few hours, I was in an induced coma. I remained in a coma for the next 11 days after a septic shock, where the consultants told my family I had about a 10% chance of surviving, and if I was to pull through, it would almost certainly be with life-changing effects, whether amputations, whether brain damage, or other severe effects. Fortunately, of course, I was extremely and unbelievably lucky. I was lucky largely, of course, because of the amazing care that I received from Russell's Hall Hospital in Dudley and the staff there. But above all, I was lucky that on that Saturday morning, as I was presented to A&E, the nurse who's just walking past happened to recognise that these symptoms that look much like any number of other conditions, particularly often meningitis with rash, that actually they needed to check, could it be sepsis? Because sepsis is a life-threatening condition. It's a response to infection that can lead to tissue damage, organ failure, and death if not treated promptly. But still, despite the severity and the number of deaths and the many, many other people who were left with their lives fundamentally changed by sepsis, very few people would be able to spot the signs, and of course that delays diagnosis and treatment. Even the GP, the GP in France, who I'm sure was extremely well qualified and professional physician, didn't spot that this could be sepsis. And that lack of awareness contributes to the staggering statistics that the Honourable Gentleman went through, with around probably 48,000 deaths a year in the United Kingdom due to sepsis. That means that in this 60-minute debate, the chances are 5 more people will have lost their life to sepsis by the end of it. A further 25 will have had their lives changed by sepsis. And globally, it affects around 49 million people across the globe, with probably about 11 million losing their lives each year. And there's a growing body of opinion that thinks that believes that actually probably the majority of COVID deaths were actually COVID deaths with the infection triggering that septic response. I keep on saying probably because, frightening as these figures are, they are best guesses. We don't know because actually the reporting, although in the United Kingdom the reporting is better than in almost any other country, it is still not consistent. It is still quite possible that it will just be recorded as a multiple organ failure or respiratory failure, despite there being a case of sepsis or a septic shock. And so it is so important if we are to step up to the challenge of reducing those deaths, which, as was being said, does represent more than the lives lost to breast, bowel and prostate cancers combined every single year. We need that sepsis register so that we know how many cases, that we can then see how those cases progress. Because one of the most alarming aspects of sepsis is that it's it does often go unrecognised until it's too late. I was lucky that it was spotted as I presented at A&E, because even 2 or 3 hours longer might have been 2 or 3 hours that made the difference between that 10% chance of survival and something quite minuscule. Our friend and former colleague, Lord McKinley, was similarly fortunate that although his condition had deteriorated at an astonishingly rapid rate, it was just caught in time for him to be able to survive. That early identification and diagnosis is important because in most cases, timely antibiotics, a broad-based antibiotic, intravenous antibiotics, will usually be enough to stop the infection from triggering that septic responses. And so promoting Sepsis Awareness Month isn't just about sharing statistics or stories, it's about saving lives. By educating the public and healthcare professionals about the signs and the symptoms of sepsis, we can ensure that more people receive the urgent care that they need. And the Sepsis Trust, which do so much amazing work in the UK, led by the incredible Dr. Ron Daniels, have a 3-point plan that I think we all need to get behind. We need to be able to measure and publish performance data on sepsis care pathways so that we can see how these are responded to, that we can measure both the success and obviously where things haven't been done correctly. We need to make sure that there are fast and reliable diagnostics to allow those who are on the front line to make the correct decisions quickly without lengthy waits for test results to be returned from central laboratories. And of course, we need to increase awareness of sepsis, which the Honourable Gentleman is doing so well with his debate today. We need to make sure that medical professionals and the public are able to ask that question: could it be sepsis? I'm here speaking with a slightly croaky throat. So I'm fairly sure this time it isn't the strep B infection that triggered that septic shock in January 2017. But I can be confident because, unlike nearly 8 years ago, I'm all too aware of the signs and the symptoms of sepsis. That slurred speech or confusion, the extreme shivering or muscle pain, passing no urine for a day or more, severe breathlessness, and what's normally described as it feels like you're going to die. But having been there, actually it's almost more, it feels like you want to die. And the skin that's mottled or discoloured. I think if the public as well as healthcare professionals across the system can be aware to look out for those 6 signs and to ask that question, could it be sepsis, then many, many more lives could be saved. And for people like Abby, who the Honourable Gentleman spoke so movingly about, like Lord McKinley, if that can be spotted earlier, we can make sure that those life-changing conditions can be spotted far sooner and dealt with.
Mr. Byrne, can I thank the member for bringing this motion here today, and also bringing not just that political side to this debate, but also the personal side and the story of Abby here, and I congratulate her for her braveness in being here today and hearing this. I think what I reflect on what the member has said, and will reflect to the Minister as well, there's so much we talk about when it comes to health and health being devolved to the other nations. I think at times we have to take a step back and actually see what our National Health Service can do at a national level. And I think the members ask for an awareness campaign around sepsis is something that surely our public health agencies and our health trusts and ministers and departments across this United Kingdom can actually take this issue on and take it forward as something that can be looked at on a four nations basis, because it does affect everybody. It affects every region equally as well. So I think there's something that we can do, and I thank the member for bringing it here and raising it actually here today. I was Health Minister in Northern Ireland for 3.5 years, and it wasn't something that I say, and looking back, that was high on our agenda in regards to that, or even high on my agenda as Minister at that point in time. And I think the realisation and the stories that have come here today from Abby, from the member that's brought it, and the member who spoke prior to me, actually, I think brings it home of the seriousness of it. So I look back to see what had been done in Northern Ireland in regards to awareness of sepsis. And it was actually Unison in Northern Ireland back in 2019 ran an awareness campaign for their own members. Our South Eastern Trust, one of our 5 geographical health trusts, ran a campaign back in 2020. But I could find nothing centrally that had been done by our public health agency that had pushed it out. So there's so much more we can do. But I think a positive, Sir Christopher, that I did find, actually just last month, there has been a piece of work done between Sepsis Research FEAT and the James Lind Alliance in regard to identifying the top 10 research priorities which could shape the future of sepsis treatment and care, with actually the goal of saving tens of thousands of lives each year, as well as the financial implications that the member talked about. And they talk about those top 10 priorities actually addressing the critical questions that include how to improve the accuracy and speed of diagnosis, something that's been mentioned here today, exploring alternatives to antibiotics, and actually investigating the long-term effects of sepsis, actually which is now referred to as post-sepsis syndrome because of the after effects of having this illness. And as a life-threatening condition that can affect anyone, sepsis often progresses rapidly, leading to death or those life-altering consequences for survivors, even as far as post-traumatic stress disorder being identified through previous sufferers as well. And so, Christopher, why I mentioned that research is actually one of those things that was actually co-chaired by a professor from Queen's University in Belfast in regards to that work, that it can be brought forward and what can be done in regards to sepsis. So I would encourage the Minister to look to that research that was published last week. It was, again, co-chaired by a professor from Queen's in Belfast, from a professor in Cambridge, and one in Edinburgh as well. So I think there's a piece of work coming out of this debate today that the Minister can take forward and look into that research, but also engaging with his other ministerial counterparts across this United Kingdom and following the member's appeal for that UK-wide awareness of sepsis and what can be done to prevent it. And again, just in closing, Chair, can I congratulate Abby once again for being here to put that personal face in regards to what is a very challenging condition, but also, I'm sure, a very positive, hopefully, outcome from this debate today.
Thank you, Sir Christopher, and it's a pleasure to serve under your chairmanship today. I want today to recount the experience of my constituency colleague and friend Richard Lochhead, the member of the Scottish Parliament for Murray. Late last year, Richard became ill with flu-like symptoms at an event in Edinburgh. Days later, back in Elgin in the constituency, he had collapsed at home and was blue-lighted to Dr Gray's Hospital in Elgin and then on to Aberdeen Royal Infirmary. He had, of course, developed sepsis from what seemed like common flu-like symptoms. Richard has said publicly, and I quote, "There's no doubt that I'm lucky to be here." The sepsis had attacked his heart and he required emergency open heart surgery. An otherwise healthy individual who enjoys cycling, hopefully he'll be able to get back to that. I certainly think he will, going by how he looked when I saw him most recently. He spent 6 weeks in hospital and said there were times when he, again quotes, couldn't do anything. He also described having to learn to walk again. He lost his voice and that took several weeks to return, which for any politician, obviously losing your voice is quite a difficult thing to deal with. Richard has thankfully made a faster than expected recovery from, frankly, being at death's door, though that recovery has still been many months, and he is now back representing his constituents in his inimitable style and carrying out his ministerial duties in the Scottish Government most effectively. I'm sure colleagues will join me in wishing him well for his continuing recovery, albeit he is most of the way there now. A combination of expert care, his own determination, and arguably some luck got him to that point. However, many others, as we've heard from colleagues today, are not so lucky. It was reported in the pages of the excellent Press and Journal newspaper that in the last year alone, almost one person a day in Grampian, Highland and in the islands has died from sepsis. More than 2,200 patients needed ward treatment, around 6 admissions a day in an area represented by just 11 MPs. With over 600 MPs in this place, that gives an indication of just how big and shocking an impact sepsis has. This is, bluntly, a life and death issue, and I commend the Honourable Member for Ashfield for bringing forward this debate and vitally keeping this issue in the spotlight. The symptoms that have been described by others around this chamber are absolutely critical for people to understand and to don't gamble with whether it may or may not be. If you have the slightest inkling that sepsis might be a potential cause of an illness, then get it seen to, get to a doctor, get to a hospital and get checked out.
Start by thanking the Honourable Member and my Honourable friend for having this debate today. It's hard to think of a more appropriate topic. And also if I could thank Abby for coming in, who may have shared quite honestly the warmest smile I've seen in a long time. So thank you to you and your husband for being here. It's a privilege to meet you both. I wanted to just take a moment as well to share a personal story with me as to why I think this may be one of the most appropriate things we can do as members of Parliament to draw attention to this. So I have 4 young children at home, and after our most recent one, my wife began to suffer with some of the symptoms we've discussed today. And very much like yourself here, tough Brits don't very easily give in to the hospital. But it just so happens, as fate would have it, we had a meeting that morning with a carer who wanted to check with any women who'd recently had children, pop round, check on the baby, check on her welfare. And while both my wife and I were quite adamant that everything would be fine, this skilled professional spotted the symptoms immediately and demanded that we were rushed to hospital. We were at hospital within half an hour, and within another 20 minutes there were around a dozen doctors, nurses, support staff rushing around like maniacs. And while I can't remember the specifics of the numbers, we're talking 10-fold, 15-fold, 20-fold what they should be in a healthy person. And the staff, in very real terms, may have saved my wife's life. And that's why I wanted to take this moment to just recognise why I think this is not only quite appropriate, but extremely appropriate, because the consequences of catching this is that it's very minor. The consequences of us not catching this are extraordinarily severe, and the difference is cheap. It is education. It is information we can all carry with us for free, and we can all benefit potentially someone's life with. So if I could just take one last moment to again thank Abby for sharing her story, again thank my honourable friend for holding this debate, and for thanking the extraordinary staff at South Basildon and East Thurrock, Basildon's University Hospital. Thank you very much.
There are 2 more speakers, and there's 6 minutes to go, so 3 minutes each. Jim Shannon.
Thank you. First of all, can I thank the Honourable Member for Ashfield for raising the issue. He and I spoke this week, and it's because of his perseverance and his working hard to try and bring this to the Chamber with a chance to make a contribution. I can also commend Abby for coming along here today for her personal story that the Honourable Member for Ashfield referred to. I salute your courage, your bravery, and as everyone has said, your smile as well. Through all these hard times, a wonderful smile. As the DUP's health spokesperson, I add my voice to the members here today to raise awareness for sepsis. We have a tendency sometimes to think that with superior hygiene and antibiotics available on tap, sepsis is a disease of the past, but quite clearly it isn't, as others have illustrated today. The sad fact is that in the time of this 1 hour debate, 5 people in the UK will pass away and lose their lives. So this debate today is to hammer home the need for people to be aware of the signs of sepsis. My dad had sepsis in hospital a long time ago. I have to say it was a minor case, and advantage of that wasn't that he healed quickly because he was in hospital right there where the nurses were, and the reaction was immediate and to ensure that he survived. Most parents are aware of the glass test for meningitis that has been hammered home on multiple occasions. But when I did a quick survey of my office staff, three out of that 5 are parents, and one having a training in St John's Ambulance. It shocked me that the only person who actually knew what it was a St John Ambulance volunteer. The others said about extremities and turning black. There's almost an end stage at sepsis, of course. We need to be aware of the symptoms before that. And this quick survey has pushed me into thinking that more awareness needs to take place for parents and indeed communities as a whole. I know the Minister would try to respond to that. He always does. He's very assiduous in what he does. The charity Sepsis NI said that currently in Northern Ireland we have no recovery protocols in place for recovery from sepsis. Although this is not just a problem in Northern Ireland. When you leave the hospital, just because you may have been treated and survived doesn't mean that you're in any way better. In fact, most of those are still seriously ill and need both physical and psychological help. We still need to work on a GP and hospital aftercare plan. I would hope that the Minister would share some of his ideas with the Assembly back home. This is something that must change, and we need a UK-wide strategy to deal with this across the UK as a whole. The best guess for Northern Ireland, just statistic, good one to put on record lastly, 7,020 people will be affected by sepsis this year. 1,240 will die from that. If these facts don't scare you, then they need to. People need to be aware of the symptoms: fast breathing, the dizziness, the pale or mottled skin, high temperature, cold body. We all need to be able to call these to mind as quickly as we do other major killers, such as meningitis. This debate is a good step in raising awareness, but I support very much what my colleagues in asking for more to be done centrally in a coordinated approach to raise awareness of the killer that is sepsis UK worldwide. Again, Honourable Member from Ashfield, thank you.
Thank you, Chair. It's an honour to speak under your chairmanship, and congratulations to my good friend, the Honourable Member for Ashfield, for securing this debate. And it does seem to me these extraordinary tales that we hear from loved ones, family. A very good friend of mine very nearly died of it some 7 years ago, and I have to be honest, I'd never heard of it until that moment, until he nearly passed away. And it seems to me this could be one of the most extraordinary opportunities for our healthcare system to make a rapid difference, because it's so quick but so preventable. And it feels to me, Chair, and to the Minister, that it's in the sort of pressured environment of our hospitals and our GPs, it's so easy for the healthcare professionals to miss it. But therefore, if it becomes embedded in all of us through a major publicity campaign that could be organised really relatively quickly, that actually, if everybody's asking that simple question, could it be sepsis? In the same way that we often think, could it be meningitis? If we ask ourselves that question, and we're helping the medical professionals by asking them that question, then actually the ability to prevent death, major life-changing injuries, and to save money for the NHS, a massive win-win. And I hope the Minister can respond positively and appropriately very rapidly. Thank you, Mr. Chairman.
Call Alison Bennett.
It is a pleasure, Sir Christopher, to serve under your chairmanship, and I'd like to congratulate the Honourable Member for Ashfield for bringing this important debate forward today. I think I would also like to take a moment to thank Abby for all that you've done in your bravery coming here today, and the work that you're doing just by being here in raising the profile of sepsis. Whilst initiatives like Sepsis 6 have helped improve outcomes for people who have sepsis in recent years, urgent challenges remain, both in the awareness and the treatment protocols that we have, as well as the resources we put into treating this condition. In preparing for this debate, I was able to grab 5 minutes with a constituent and also a dear friend who has looked after her mother, who was bitten by their family dog and developed sepsis and was hospitalised and very ill for a long time, and eventually over a number of years has been able to come home. But as well as caring for her mother, she's also a consultant geriatrician locally to me in mid-Sussex. And so she has a great deal of experience of what it's like treating sepsis in a hospital. And what she wanted to emphasise to me is that actually awareness of sepsis has grown, and amongst healthcare professionals it's much better understood than it once was. And in the public at large, the UK Sepsis Trust, through their action and activism, have seen a real increase in public awareness of sepsis. So in 2012, only 27% of people understood the severity of the condition, and that figure has soared to by 2019 it reached 76%. So awareness is going in the right direction, although there is certainly more that needs to be done. But whilst raising awareness is part of it, public awareness isn't enough. And unless we improve things like diagnostic testing for sepsis through investment in hospital equipment and increased laboratory capacity, we cannot expect healthcare professionals to act swiftly if they're not given the tools they need to do their job to the best of their skilled ability. And I was really grateful to the Honourable Member for South Basildon and East Thurrock for raising the issue of maternal sepsis. In September, the Care Quality Commission reported that 48% of trusts are rated as inadequate or requires improvement for maternity services. And this sadly includes my own trust, the University of Hospitals Sussex NHS Trust. Sepsis is just one risk factor of having poor maternity provision. All maternity units must meet high standards of care. This includes adequate facilities, equipment and access to best practice care around the clock, and especially for those experiencing miscarriage. And then we move on to that emergency situation where there's a demand for ambulances. We know that demand for ambulances is intense, not just from winter pressures that come round every year, but in the longer term. For example, in my seat of Mid-Sussex, the South East Coast Ambulance Service is predicting a 15% increase in demand for ambulances over the next 5 years. And as it stands, response times for urgent conditions like sepsis need to be improved. Indeed, across England, every NHS trust, indeed, across the country last year, the NHS failed to meet response targets in every region of England for Category 2 emergencies, which includes sepsis. We need to increase the number of staffed hospital beds, improve social care to cut delays in ambulance handovers, and it's imperative that the government publishes localised reports on ambulance response times, and we must create an emergency fund to reverse the closure of community ambulance stations. So, in conclusion, while we have made significant progress in raising awareness of sepsis, the fight is far from over. We must continue to push for better diagnostics, increased funding, and improved care standards, ensuring everyone, regardless of their background, has access to the best possible treatment. Thank you.
Caroline Johnson.
Thank you, Mr. Chope, and it's a pleasure to serve under your chairmanship. Can I first congratulate the member for Ashfield on securing this debate on this very important topic, and I should also declare an interest as an NHS consultant paediatrician. I have cared for and do continue my work to care for people with this condition. I'd also like to thank Abby for coming today. I was honoured to meet you, Abby, earlier on, and hear your story from your MP today, highlighting the difficulties that you faced in getting good immediate care for sepsis and the consequences of that. And I want to commend you for the bravery that you've shown in coming today and raising it for the benefit of other people. And I do think this debate today will increase awareness, which is a very positive thing. I remember sitting in the chamber earlier this year when the former member for South Thanet, now Lord McKinley, re-entered Parliament to a stunning ovation, something that's an exceptionally rare occurrence in the House of Commons. It's truly humbling to reflect on the journey that he's been through in such a short space of time. A little over a year ago, he had no outward signs of sepsis at all, but now he's become one of the most well-known advocates for people with the disease. His case brought forward renewed attention to this disease. It kills nearly 50,000 people in the UK every year. And as the member for Ashfield said, this is the same number around the same number who die for bowel, breast and prostate cancer combined. His case speaks not only of a remarkable recovery, but also the suddenness within which sepsis can utterly change someone's life. And as many people have said today, the early identification is vital. Under the previous government, awareness of sepsis has improved significantly, as has the clinical recognition of symptoms, screening rates, and the administration of antibiotic treatment. But there is much more to do. I also want to commend the UK Sepsis Trust and other public campaigners who played a significant role in improving awareness of sepsis among the general public. A recent YouGov survey showed there's high levels of public awareness in the UK compared with other countries. And I'd like to ask the Minister what steps the government is going to take to work with NHS England and patient groups like the UK Sepsis Trust to raise public awareness that people can more easily identify the signs of sepsis. And also, as I've asked one of his ministerial colleagues but have not received an answer yet, the Chancellor said she was cutting the communications budget. Can he confirm that's not going to affect the important public health messaging that campaigns like this would be coming from, the budget would be coming from? Because it's very important that we don't cut a budget that's going to save people's lives and indeed the NHS money. It's also important to raise awareness not just in the general public but also amongst health professionals, medical staff in both hospitals and communities. The National Early Warning Score has been introduced and is being rolled out. And Sepsis 6 was developed with the UK Sepsis Trust, the 6 being oxygen, cultures, antibiotics, fluids, lactate measurement and urinary output monitoring, with the all be done within the first hour. Has the Minister established how well these are being rolled out across the UK, and what is he doing to ensure they're being rolled out effectively? NICE updated the guidance earlier this year. Has he, can you give the House an update on how effectively that's being implemented across the UK? Also, before the election, Martha's Rule was introduced. That's the ability for people to get a second opinion from another health professional if they remain concerned about their loved one or themselves. Could you update the House on the work the NHS is doing to roll this out too? Research is the cornerstone of transforming sepsis care, and the last government invested over £1 billion through the NIHCR. But it's important that we research the causes of sepsis, the treatment of sepsis, and also new antibiotics, because we do start to see antibiotic resistance to infections. And if we don't invest in antibiotic research, then they won't be developed, because we are essentially asking people to develop a drug to keep on the shelf for when we need it. And there's no money in that, so it won't get commercial take-up. So it's important that the government invest in that. The UK Sepsis Trust is also calling on the government to publish data on the sepsis care pathway, so we can see where it's being performed really well and where it's performing less well. And I'd urge the government to do that, and if the Minister could confirm they're going to do that today, that again would be really helpful. As we close the debate, let us remember what we're fighting for. Sepsis takes lives of 50,000 people every year. It strikes suddenly, often without warning, as Lord McKinley's case so powerfully reminds us. Early identification and rapid treatment are the keys to saving lives. We've made strides, awareness is growing, but we must do more. We must continue to improve the recognition, strengthen control, and push forward with life-saving initiatives. I urge the government today not just to maintain but strengthen its commitment by partnering with NHS England, publishing more data, researching the causes of sepsis, and ensuring we can fight this disease together.
I thank the front benches for sticking to their 5 minutes, which means that the Minister's got 10 minutes and hopefully a couple of minutes for the proposer to reply. Minister.
Thank you very much, Sir Christopher, and it's good to serve under your chairmanship. Can I start by welcoming new members to this House? I know it's 3 months since the general election, but this is my first opportunity as Health Minister to welcome those that clearly have an interest in public health and prevention matters, and I want to assure all members of the House that I will work with all of you to try and get those better outcomes. It's how I've always operated in opposition, working across party, and I seek to do the same in government. I also want to welcome the Shadow Minister to her post. We did very briefly go head-to-head in the past when I shadowed her. I hope that she gets to shadow me for longer. And I also want to congratulate the Honourable Member for Ashfield for securing this really, really important debate. He's a chap that always wears his heart on his sleeve. And, you know, whether you agree with him or not, he's always forthright and passionate about the causes that he cares for. And actually, this is a cause that I think there is commonality across the House. And I want to sincerely thank him for putting forward such an eloquent case to myself as the new Public Health and Prevention Minister, but also setting out the story of his constituent, Abby. And I'm going to make her blush because we've all said it, but you've got a wonderful smile. You really have. And I hope you'll still be smiling at the end of this debate because, you know, I really want to make sure that the government does more on this area of raising awareness of sepsis. I think that, look, I've always taken the view, Sir Christopher, that members vastly enrich our debates with their own experiences and that of their constituents, and we heard it again with other contributions in the course of this debate. And I want to start by saying, as the Minister, that my deepest condolences go out to the families and friends of everyone lost to sepsis, including those that will be watching this debate elsewhere. Sepsis is a devastating condition. Last month was Sepsis Awareness Month. And before I begin my remarks, I want to pay tribute to the outstanding sepsis charities, including the UK Sepsis Trust and Sepsis Research Feet. They do so much to raise awareness, to support families and to fund research. The Shadow Minister mentioned Martha's Rule, and I want to touch on that because throughout the history of the NHS, families have been at the heart of driving change and indeed holding our health service to account. You may have read, as I have, Marote Mill's article in The Guardian describing her daughter's last few days in hospital. It was a difficult read. No getting away from that. And I can't even begin, Sir Christopher, to imagine how difficult that article was to write. At just 13 years old, Martha was a bright, bubbly young girl, and in her mum's own words, a feminist in the making. She should not have died. Her parents should have been listened to. They should have been kept in the loop. And they should have been treated with the respect that they deserve. Talking to families should never, ever be some tick box exercise. On the contrary, nobody knows their child better than a mum and dad, as we know. So families have a critical part to play in their own care, and we need to ensure their concerns are both heard and acted upon. Thanks to Martha's parents and other campaigners, NHS England will roll out Martha's Rule across 143 hospital sites by March next year. This initiative will enable patients and their families to seek a second opinion or a rapid review from someone outside their care team if they're concerned that their condition is deteriorating. Now, on sepsis training, Sir Christopher, NHS England has developed specific sepsis training resources to improve sepsis recognition for clinical and non-clinical staff in the NHS. And guidelines for recognition, diagnosis and early management of suspected sepsis were updated earlier this year. It is critical that these updates are constantly implemented by frontline clinical staff to drive the real improvements on the ground. It's also important that we recognise the life-altering complications of sepsis, such as multiple limb amputations, as again has been so eloquently set out by the Honourable Gentleman. And again, I want to thank Abby, for being here today. There is nothing more powerful than your presence in the gallery. Physical rehabilitation is an important part of the recovery process. It can be a long, difficult and frustrating process, so it is important that the NHS continues to place patients at the heart of rehabilitation services and to focus on meeting individual goals and improving their quality of life. Sir Christopher, on public awareness, as has already been said by numerous members in the course of this debate, we all remember that incredible moment when Lord McKinley, who had a life-threatening battle with sepsis, walked into the House of Commons chamber just before the general election was called. His moving testimony shone a spotlight on the physical and the emotional pain of sepsis survivors and their families. I welcome his advocacy in this area. In the NHS, our focus must be on improving the early recognition and the clinical treatment of sepsis. And I think we should thank everyone who has campaigned on this. Now look, sepsis is a clinical complex condition. The signs and symptoms vary hugely, particularly in the early stages. Moreover, sepsis is not a single disease. It does not have a single diagnostic test. The NHS has got better at recognising and treating sepsis by the introduction of the National Early Warning Score. This is a screening and decision support tool used by 100% of ambulance trusts now and 99% of acute trusts in England. Last year, NHS England ran a financial incentive scheme to encourage the use of the National Early Warning Score to improve responses to unwell and deteriorating patients. And several trusts have also rolled out the National Paediatric Early Warning Score to ensure the recognition of deterioration in children. We need to maintain that momentum, continuing to improve care and to reduce the preventable deaths from sepsis, because they are preventable and we should do all we can to prevent it. I want to see patients and families empowered to seek timely medical help. The job of the healthcare system is to ensure that frontline staff can recognise sick patients and respond quickly to provide life-saving treatment. To support this, in the last 5 years, the National Institute for Health and Care Research has invested over £19.7 million in funding to 20 research projects on sepsis diagnosis, management and treatment. And they welcome applications for research on sepsis. Very briefly, I want to touch on antimicrobial resistance, because our treatment on sepsis does rely on effective antibiotics. That's why we are focused as a government on tackling antimicrobial resistance through implementing the UK's 5-year National Action Plan. And then on improving the awareness. I spend almost every day thinking about prevention. It's in the title of my job, and preventing infection is the best way to avoid sepsis. I agree with the honourable gentleman and indeed other members that we should be doing all we can to better educate and inform. It is heartwarming that in the latest statistics that we have, that awareness of sepsis is not only increasing, it's at relatively high levels, but we should never rest on our laurels. We always have to keep reminding people of this, and that's why I will work with the honourable gentleman and others to ensure that we get the support we need. On two other issues in closing, I will work on a four-nation basis with the colleagues across the devolved administrations. One of my first jobs was to talk to Mike Nesbitt, the Health Minister in Northern Ireland, and indeed the Welsh and the Scottish Health Ministers on health issues that we have a common approach to, and this has to be one of those. And then just to assure the Honourable Lady, the Shadow Minister, the comms budgets will not be cut for public health measures.
Thank you, Secretary. Christopher. I want to thank every honourable member today for making some wonderful contributions and sharing some stories which I think my colleague, the member for Kings, Swinford and South Staffordshire, summed it up perfectly. Could it be sepsis? I think that's the question that all health professionals and families should be asking themselves if they see these symptoms. It's been a wonderful debate. And once again, I want to thank Abby and Steve for coming up, because it's real-life stories like Abby's story that inspire us as MPs to tell their stories in this place. And if we can't do anything about this, you know, have a campaign, then I would be very disappointed. But I've been very encouraged by the Minister, by what he's had to say today. Really encouraged by fellow members from all parties. And all I can say to sum it up, Sir Christopher, is could it be sepsis? Thank you.
The question is that this House has considered sepsis awareness. As many other opinions say aye. The contrary no. I think the ayes have it. The ayes have it. Order, order. The sitting is adjourned.